All right, well, welcome everyone for joining us today. There's going to be a little bit of echo just temporarily in the room, just for people who are here. But we want to thank you for joining us together for DCRI, Tuesdays Together. Today, we're focusing on the importance of hands-only CPR with our own race cars trials team. And so we're going to learn a little bit more about their work, and they're going to share some of the critical training that could one day potentially have you save a life. So we are going to go ahead and get started with our presentation with the race car teams. Go ahead and share my screen.
Just to the next slide.
Yep, exactly.
Okay, great. Good morning, everybody. Thank you for having us today. I think, as you all know, February is considered Heart Month, so we thought this would be a great opportunity to come and talk to you a little bit about the race cars trial and to go through hands-only CPR in the AED or shock box. So I want to start first with a little story. About 2 years ago, Damar Hamlin, who is a Buffalo Bills football player, took a hard hit to the chest and he collapsed on the field. And immediately, the staff recognized that he was in cardiac arrest. They started what we call bystander CPR, and they brought an AED, which stands for automated external defibrillator, or a shock box, and shocked him back into a normal rhythm. And so it was on national TV, and it really increased people's interest in this thing that we call cardiac arrest. I want to talk briefly about the difference between cardiac arrest and heart attack, because people confuse them and think that they're the same thing, and they aren't. So a heart attack is actually a plumbing problem where you have a blockage in your artery. The heart doesn't get all the oxygen that it needs, so it starts to hurt. You have, chest pain, left arm pain, jaw pain. And that can be treated within a couple minutes, if not a few hours. So there's some time when somebody has a heart attack. Now, I will say you do want to call 911. Don't drive yourself. But a cardiac arrest is very different. It's actually an electrical problem, and it's not sustainable with life. The heart typically pumps blood throughout your body, oxygen to the brain. But in cardiac arrest, for whatever reason, it's not pumping like it should be, and you collapse. So you may see somebody actually who has a cardiac arrest, if it's witnessed, fall in front of you. You may walk in and find them slumped over in a chair, or you may wake up and you may see that this person is breathing abnormally. But those things are not sustainable with life. A cardiac arrest needs immediate intervention. And we're actually going to go through the steps. So again, a heart attack is a plumbing problem where you have minutes, if not hours. We still want you to call 911. But in a cardiac arrest, it's an electrical problem, and it actually is not sustainable with life, and that it needs immediate intervention, which is CPR and the AED. And then we certainly would want to call 911 and get help there as quickly as possible. So again, we talked about Damar Hamlin. So we're excited that the National Heart, Blood, and Lung Institute awarded us funding in North Carolina to look at cardiac arrest. And it's actually set up as a clinical trial. There are 350,000 cardiac arrests per year, and less than 10% of people survive it. And unfortunately, that's a statistic that hasn't changed in 40 years. So in North Carolina, we want to be like the NFL, right? You know that they've spent a lot of funding getting people prepared, having the equipment, and having a quick response. And that's what it takes. And so in the race cars trial, we're trying to improve survival from sudden cardiac arrest. And I realize that I keep changing my terminology, but sudden cardiac arrest, out of hospital cardiac arrest, sudden death, all the same terms. But when we talk about the race cars trial, we are talking about cardiac arrests that happen outside of the hospital. But in North Carolina, so we're looking at 4 different things to try to help improve survival from cardiac arrest. Two of them are around our 911 telecommunicators. And I just have to mention that I have nothing for respect for them. I'm a nurse by training, have worked many years in critical care. But when you call 911 and the bystander tries to describe a medical condition over the phone, it's like playing charades, but by phone. I mean, the telecommunicator has to listen very closely. But the two things we're trying to work on with them is first that when they get the phone call that they recognize quickly that it's cardiac arrest and to send the appropriate help. And so the people that we send are, and I don't know if you all know this, but fire and law enforcement are considered first responders. And there are more fire stations than there are EMS stations. So it's likely if fire agrees to be a part of your response plan, that they're going to get there quickly. But keep in mind that it takes them 4 to 6 minutes. If you're in a rural community, they're volunteer, so they have to come from home, so there's a delay. So for every minute that goes by when somebody has a cardiac arrest, the chance of survival decreases by 10% unless somebody steps in to help with CPR and the AED. So we have to get fire and law enforcement to agree to respond. So the 911 then sends fire and law enforcement. The second for 911 is to start compression only CPR instruction over the phone. So we're monitoring those two things. I am happy to say that right now, our telecommunicators have an 85% recognition rate, knowing that that person is in cardiac arrest. And probably our opportunities for improvement is how quickly they get the person, the bystander, to start actual compressions. So again, in cardiac arrest, seconds matter. So if you see somebody that has cardiac arrest, I would say while you're going to call 911, get your phone on speaker and start doing chest compressions as quickly as possible. So the first two interventions are around 911. The second is optimization of first responders, which are our law enforcement and fire. So interestingly enough, and I think I just mentioned this, they don't have to respond to cardiac arrest. So it does take communication and organization between EMS and fire and law enforcement to get them to agree. But they fire and law then also need to be trained in how to do CPR and have an AED. So interesting, but an AED is not routine equipment for fire or law enforcement. And so a big piece of our trial is helping to train the counties on how they can write for grants to try to get AED funding. It's our hope that if this trial is successful, that that optimization of the first responders will help them make that an AED is part of their routine equipment. So that's number three. The fourth intervention is around community training. So we need people in the community to recognize that the person needs help, to call 911, and then to start CPR and use the AED. There are a few things I think are pretty important. We're going to go over the steps of CPR here in just a second. But bystanders many times just don't want to get involved. They're fearful that they're going to be sued. But in North Carolina, we have what's called the Good Samaritan law. So if you step in to help, you are not going to get sued. Kind of the second big thing is that people are afraid they're going to hurt the person. But honestly, you can recover from a broken rib, or if we have to pull you onto a hard, flat surface out of your bed and you break your arm, you can recover from that. But the delay in starting CPR, a few things can happen. One is if you don't start quickly, for every minute that goes by, the chance of survival decreases by 10%. The other thing is we don't want people just to survive. We want them to survive and go back to their families like they were with their brain intact, right? So as soon as you have a cardiac arrest, you begin to not have oxygen to your brain. Damar Hamlin, I mean, how impressive is it that this is right year two since his cardiac arrest? He was actually up for the comeback player of the year in the NFL this year. So it speaks to if we know what works, early recognition, early CPR, early AED, and then calling 911 and getting the help that we need there, that people can survive. So our four interventions are aimed at, again, The two with 911, early recognition, getting the right responders there, and starting CPR. Our fire and law enforcement need to agree to respond and have the equipment that they need. And then lastly, our community needs to be willing to recognize that it's a cardiac arrest and be willing to step in and help. So that's a little bit about the race cars trial. This is our map, and I'm pretty proud of this, but we have 100 North Carolina counties. And of that, we were able to recruit 62 to come and work with us. And I think that's impressive. It speaks to the long history of race. We worked in acute heart attack and stroke across North Carolina since about 2005. So I think this speaks to people trust us here at DCRI to help them improve care within their communities. So the ones in red are our intervention counties. So when we recruited the 62 counties, they were randomly assigned to either intervention or control. The 4 interventions that I talked about, the counties in red, we work very closely with them. We have lots of quality improvement projects with them, training and education, a lot of work about implementation science, making sure that they're able to adopt and implement these interventions to the best of their ability. The ones in the darker gray are our control counties. So they just continue to care for cardiac arrest patients as they always have. It's always interesting, but they say, well, what if the American Heart Association has a guideline change? Are the control counties allowed to do that? Yes, we would never tell them to stop their work, but we don't work closely with them. With our intervention counties, we provide data and feedback. We run monthly calls. Tyler spends a lot of time in the community efforts. So there's a ton of work that goes on with the intervention counties. And then the lighter gray counties are the ones who, for whatever reason, chose not to participate. And we almost have 80% of North Carolina's population covered with this trial, which I think is totally impressive. This is the more formal diagram of the trial. Again, we're trying to improve survival from sudden cardiac arrest with good neurological function. I talked that we recruited the 62 counties. They were divided, randomized into control and intervention. We're pretty fortunate in North Carolina because between 2010 and 2015, we had a quality improvement effort with all counties across North Carolina working to improve cardiac arrest. And at that time, they started entering data into what is called the CARES registry. It's the Cardiac Arrest Registry to enhance survival. So we didn't have to do a lot of training and education around the EMS portion of this. But the one thing that we did have to do is with our intervention counties, we had to ask their 911 to enter data into this CARES registry, and they are doing an outstanding job. It has been fascinating what we have learned from their data, and there will be lots of analyses done so that we understand how we can help our 911 colleagues improve their treatment of cardiac arrest cases. And then we are monitoring a number of things: bystander CPR rates, AED application prior to EMS arrival, how often our 911 telecommunicators recognize that it's a cardiac arrest. And then the other kind of cool thing that we're doing is we have a long-term follow-up study. And as you recognize, only 10% of these patients survive. And so there aren't a lot of survivors. There are very few guidelines on how to manage these patients, not really from a medical perspective, but more from a psychological perspective. And as you all can imagine, many of these patients end up with short-term memory loss. They have no idea what has happened to them. So they almost present like a PTSD. And so following up with them at 3 months after their cardiac arrest and then again at a year, I think really will help give us guidance on how these patients should be managed after a cardiac arrest. So with that, I'm going to stop and see if there are any questions before I walk over to show you the steps of CPR. Any questions? Yes. The intervention part of it is 4 years, and July 1, we will start year 4. So not about 17 months left to go. Overall, it's a 17-year trial. It took us, I think, Kimberly, 18 months to get up and running. Yeah, and then there's another 18 months we have to wait on the last case that goes into the registry. It's 1 year from that point that we have to follow up with that. Any other questions? After this, well, I honestly believe that there needs to be work around 911. It's fascinating, but the AHA guidelines right now recommend that they do these things we're asking them to do, and it's a recommendation, but not a requirement to track data. And I don't know if you all know about 911, but they actually buy their protocols from companies. And so I think there's opportunity for those companies to allow us to do some research and maybe make those protocols better. A great example is 40% of patients that have cardiac arrest have what's called agonal respiration. It's abnormal breathing. It is not sustainable with life. But that is pretty difficult for a 911 person to evaluate over the phone because bystanders have a hard time evaluating the breathing, right? They're thinking, oh, they're breathing, but they're not really breathing. And so to remove that question out of the 911 protocol might be the right thing to do, right? If they ask if they're responsive and they're not, then maybe we move straight to CPR. We joke, but one of our medical directors used to say, I'd rather the person tap me and say, stop doing CPR, than because many times it's missed, right? And that's devastating, right? That person, if they recover, then also might end up with neurological brain damage because of the delay. Yes.
We run into the problem of I went one end of the answer, and it took 25 minutes. I could go to the button, and that experience, was deeply scary for me. And so interventions, I'm always like, wow, that sounds great, but you have to start with my.
Yeah, so y'all, it's fascinating. There are a number of issues with 911. First and foremost is it is a very low paying job. You can make more at Chick-fil-A than you can as a 911 telecommunicator. And that's sad because their hands really are your life is in their hands when you call them. So there are issues with turnover and actually recruiting people to become 911 telecommunicators. The second issue we run into is they're not recognized as professionals, which again is a shame. So I do think that, this is where legislative work may be important to try to help 911 get more resources and recognition so that it is a job that people actually want to do. And, many of them have been around like 40 years because they love what they do and they know they make a difference. But we have a younger generation that's interested in working from home. They don't want to come in. So we have to figure out how to bridge that gap. But finding 911 to always answer. Yeah.
Safety assumption that I'm already answered, and I started thinking to it. First time,
Yeah.
Yeah.
Do you think, not now, but in years to come, that maybe AI plays a role in this in terms of, both translating over, because there's also, in addition, not enough telecommunicators, also speaking different languages is an issue as well. So, like between that and also just the fact that a lot of support roles are going that direction, I wonder if that's an area that, as public trust increases in years to come, I think that.
I'm hopeful for that. And I know that I want to say it was either Sweden or Denmark actually did a small evaluation of that, and they stopped it because they couldn't get it to recognize it often enough. So the telecommunicator actually had been trained well enough that they were doing better than AI. But do I think if we can train AI better, right, to recognize that that might be some opportunity? So definitely AI for sure. The other interesting thing, we visited Sweden and Denmark for our drone work, and their 911 telecommunicators are actually medical professionals. They're nurses or EMTs or paramedics. So our the only requirement for 911 is a high school that you graduated from high school, and then the rest of the training is as you come in, then we train you. It's fascinating. They multitask, but they're putting in information to the computer while they're talking to the caller, trying to figure out, okay, and then they have to pick which protocol, to go down. So it is a very tough situation to be in.
Great profession if they are.
Yeah. Yeah. And the other interesting thing, cardiac arrest is only about 1% of their calls, so it's a low volume but high risk. And so what we all know about that is that training needs to happen more often. And I'll just be honest, they have continuing education that has to cover all the protocols, whether it's trauma or cardiac arrest. So while I'd like to think they're focusing on cardiac arrest, that's been part of our work, is to try to provide them routinely with training and education on a monthly basis to help bring it to the forefront.
Too, about just the pay, demand. Ideally, trials like this, if you have positive results or you find gaps and deficits, this is a way you can leverage those to talk to politicians, local legislators, what's policy. So again, it's showing that data and how many lives can be saved. I think this is that dissemination lane that hopefully we can get better at.
We see a similar issue with volunteer fire as well, that the younger generation just isn't interested. And I don't know, we're looking at some different apps. Heart Runner would be one of them, where off-duty personnel would be willing to respond to cardiac arrest to try to bring an AED with them and to start compression-only CPR. So we're actually trying to get that funded to run in a couple of our intervention counties. There's a similar one in the US called Pulse Point. Yeah. Other questions?
Can you repeat the name of that kind of breathing? Adenoidal breathing?
Agonal, AGONAL. It looks,
Agony.
yeah, that's the truth. And it looks like a fish out of water, honestly. It's that, I call it guppy breathing. The fish is laying there and they do that. They open their mouth, but you can see that the chest is not moving. So if it's slow, it might be described as snoring or gurgling or raspy. Many times when you listen to the 911 calls, you can hear the person in the background. Yeah. My husband does a great, I'm kidding. He snores a little too much at night. Any other questions? Yeah. $1,200 to $1,500. You can buy them at Costco now. A couple things that I will tell you. One is that it really doesn't matter which AED you buy. They're all set up with simple steps, which is to open it, power it on, attach the pads. It will analyze and then recommend a shock or not recommend a shock. The big things to look for: battery costs on some of them can be bad. So you want to get the ones that you can go to Walmart and replace the batteries. So that would be something to look at. The other thing is the pads do expire. They have adhesive in them and they will dry out. And the pads, I think the last time I looked, were like $70. Yeah.
And what are the regulations that are out there where AEDs have to be? Like, I'm assuming, aren't there some sort of laws about
One would hope, but it's interesting you asked that question. So in the 80s, the American Heart Association started what's called a PAD program. It's public access defibrillation. And they asked us to put all these AEDs out in public places. What they didn't ask us to do was to track the locations, right? And so 911 really needs to know those locations so that they can say, you can say, I'm at the mall near Starbucks and we have a cardiac arrest. And they say, oh, well, right around the corner, send somebody to get the AED. But I think it was 2022, AHA came out with a new statement. And they said that so the other thing that happened is, because they're $1,200 to $1,500, people were locking them up in their offices because they didn't want to get them stolen, right? So what we know now is they need to be in a prominent place where people see them, recognize them. Like interesting near the fire extinguisher is a good place, or near the fire alarm, but where they're out in the public. The other thing is helpful is to have AED signs. And then for people to have, if you're a business, to have an emergency response plan in place. The one thing that we do challenge now is put it outside, so that, for instance, in our rural counties, volunteer fire, it might be that they could pick it up from a local church instead of having to go all the way back to their station and then drive to the cardiac arrest. So thinking about how we might get these so that they're 24/7 and that 911 would know that they're available all the time.
Thing too that was shocking to me is that I was under the assumption that volunteer fire would always have, maybe you already covered this, would always have an AED in their vehicles. And some counties are entirely staffed by volunteer. And also fires in law enforcement are the most likely people to show up to cardiac arrest first. But there's no regulation that they have to have one. In fact, any fire department, volunteer fire departments do not have AEDs. So if you live in a rural county in North Carolina, there's a decent likelihood that fire arrives in the scene and they don't have an AED, usually because of, again, funding issues and other barriers as well. But yeah, that's something that we're strongly advocating for in one of our interventions.
Any other questions? One other thing that I want to mention is, bystanders sometimes don't want to step in and help, but the reality is that 80% of cardiac arrests actually happen in the home. So the chance of you helping somebody is probably going to be somebody you're either related to or you know. So important. So I'm going to go through if you want to swing around. Yes. So we're fortunate in North Carolina, a couple things. One is that we do have a mandate that in order to graduate from high school, you have to have CPR training. And then the AEDs are supposed to be placed in federal buildings, but most of our schools.
Well, athletics, football, I think is supposed to. I think that is a regulation. Am I right on that?
There are some regulations around sporting events. In fact, I just read one about requiring for middle school and high school events. But what we know is there's definitely work still to be done.
And for example, again, former athletic trainer here, you could be at a large school at a sporting event, and I mean, the campus can be enormous, so they only have to have, at least years ago, one. So that AED could be on the complete other side. And so, it's all that hopefully takes 10 minutes to treat.
Any other questions?
Like things like that have to happen, or is that just like that?
Not required. It's the nice thing to do. But you're going to start looking around for AEDs now that you've had this training. I'll be honest, and you're going to look at them and say, "Gee, I wonder if they've checked those or if those pads are working." In fact, I go to a gym in Mount Airy. We just moved up there, and I laughed the other day as I'm on the treadmill because they lock the door between the workout room and the lobby, which I find interesting because the AED's in the lobby. So if somebody walks out so I've just made a habit. I keep my card around my neck, but I am going to talk to them about that. Yeah. Other questions? First, as you walk in, but the only bad thing about this, and I think they should move that AED, but it's behind the kind of partition by the bathrooms, and it really should be out by the desk where you can see it.
Chris Granger's voice is frustrating many times.
Yeah. So y'all quickly, I'm going to go over the 4 steps. This is the 4 C's to save a life. I'm going to walk through real quickly the check, call, connect, compress, and connect. I have to get the steps right, but I'm going to have you just kind of follow me for a second. And I want you all to try this. I'll do a quick demo. The other thing I want to mention is for those of you in the room, we actually have a little heart. And these are like 2 3/4. So if you'll take one of these when you leave, there's more in the box up here. You actually can put your hands on chest and get a feel for how hard it is to push down 2 inches on the chest. So it's a good little practice. Yeah. Okay. So I'm gonna swing around here and do the quick demo. So I'd like to say that ideally you witness somebody have a cardiac arrest and they fall in the floor, because it is ideal to have them on a hard, flat surface. Always happen, right? Like you might find them in bed, or you might find them slouched over in a chair. And 911 will direct you to try to get them to the floor. But the reality is we don't want you spending too long trying to get them there, because again, for every minute that goes by, the chance of survival decreases by 10%. So make an effort, push them out, roll them out, tip the chair over. But if you can get them to the floor, that's the place we want them. So the first is check, and you're checking to see if they're responsive and breathing normally. So all that you have to do, sir, are you okay? And then just a quick look to see if you see that they're breathing. If it's not normal breathing, again, you're going to start CPR. So then we want you to call 911. And I'll just tell you, I would love for you, if you see somebody collapse and you can tell you're going to need help, I would say, go ahead, open your phone, get it on speaker, and get that person and you get into position so that you can start compressions even before you make that 911 call. So the check for responsiveness and breathing, you're going to call for help. If there's somebody around, you do want somebody to come and help you. For after 2 minutes of CPR, you're only about 80% effective. So if there's somebody else to help, we want them to come in and help you. But also somebody else can call 911 while you start CPR so you don't delay. The other thing is you would also tell them to go get the AED. If you know there's an AED in the building, like at DCRI, I would say, Tyler, go get the AED, and I would have somebody else in the room call 911. So we've checked for responsiveness and normal breathing. We're calling for help and 911. The next is compress. So this is the breastbone, and then this is the mid nipple line. You're going to take the heel of your hand and place it along that the sternum or the center of the chest. And you do want to try to keep a straight line so that you're taking advantage of being on the breastbone. So your heart sits here, and you're trying to push the breastbone against the backbone so that it pushes the heart down and pushes the blood out. And then we want your hands to come back up to where they started so that the heart can then fill back up. So you're pushing down and up, down and up. So it's about 2 inches down. Then you want to release, but you want to keep your hand in contact with the chest. You don't want to bounce around. That's when you're going to break ribs. And honestly, if you are doing CPR on somebody that's small, it's likely that you're going to break a rib, but they totally can recover from a broken rib. So again, the heel of the hand, the center of the chest, and again, hopefully we'd be on the floor kneeling next to them. You're going to stack your other hand on top. And if you can get over, you can use your weight to help push down. So I said 2 inches, you want to push down, make sure you come all the way back up. The other thing is the rate is about 100 to 120. Staying alive, row, row, row your boat. So just depending on your generation, what song you like to sing, the HA has a great list. Baby Shark, yeah. So, but you want to push hard and fast, right? You're taking over the pumping action for the heart. So I'm just going to demonstrate what it might look like. And then Tyler's going to bring me the AED. And Tyler, don't bring that one. Bring my old one. It's easier. Sorry, I'm not quite as good with that one. So again, after 2 minutes, I'm about 80% effective. Tyler's going to open it and he's going to turn it on.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
You can just pretend, yeah.
Pads.
Can everyone see?
Apply pads. Plug in connector. Analyzing heart rhythm. Do not touch the patient. Shock advised. Charging. Stay clear of patient. Deliver shock now. Shock delivered. Pause. Begin CPR.
So it is going to wait 2 minutes and it's going to come back on. And at that time, I would have said, Tyler, you need to take over CPR because now I'm tired, right? I've been doing that for 2 minutes.
So that thing is on their chest when you do the charge.
Mhm.
And then you would remove it, obviously, you have to remove it off. But
You leave it in place. We don't want you to
how do you do
remove it.
this? How do you do this?
Right over it.
You do the CPR over it.
Yeah, some of the pads, this is interesting, but a couple things about these
So
pads
you're pressing down on the AED.
No, it's
on
to
the
the side.
chest.
Oh, yeah, sorry,
the
yeah,
chest.
side.
This machine's to the side and the pads are on the chest, okay?
Yeah, and the pads actually have pictures on them where they go, and these are really old, so the new ones are color coded and tell you where they go. But the what you're trying to do is the first pad goes here, the second pad goes here. Y'all remember where I told you the heart was, right? You're trying to pass electricity and it runs from the pads to try to get the heart back into a normal rhythm. But y'all, one shock might do it, but you still have to start back to CPR because it's unlikely that they're immediately going to come back for the heart compressing. The other kind of interesting thing is, we don't breathe on them anymore because the adults have 10 to 15 minutes of oxygen in their blood. So the only thing you really need to do is good compressions. The other thing that they found is every time we were trying to stop to breathe for the patient, it was like a brand new spray bottle, right? So it takes 5 or 6 pumps before you get that nice, good pump. So every time you were stopping, every time you started over, you were having to do the 5 to 6. So what they said is, okay, well, breathing, honestly, people weren't doing good breaths. I think the air is like 18% oxygen. So if we just do good compressions, adults have 10 to 15 minutes of oxygen, that's the thing to do, is to just do good compressions. And the new pads, the other thing they have is as you place these on the chest, they have this little puck that's in the middle of it. You actually do your compressions and it'll tell you faster, slower, harder.
Wow.
So it evaluates your quality of CPR. And that's the AED I want. Like my sister, I just taught her HOA. And they purchased 2 AEDs, one for the pool and one for the clubhouse. And they have a very nice, and they can also buy the batteries at Walmart. So it was kind of cheap.
I'm like,
Yes.
Are AEDs paid for children?
Say it one more time.
Are AEDs paid for children or only adults?
No, they are for children. And so the HOA that my sister has, it also has pads. And it's just a switch that you flip. For kids, it's a lower dose of electricity that comes out of it.
If you have an AED that was only meant for adults, but you can make it for a child, is it better to use it or not?
No, what I would do is most kids have a cardiac arrest because it's respiratory driven. Most kids have respiratory issues. So I would start with CPR and hopefully with the breathing, when EMS or fire get there, they would have oxygen and be able to supplement. But I would do good CPR until
Is there a rough age at where an AED,
less than 8. It's less than 8. Kids are 1 to 8. Yeah. And then you have your infant group, right? So infant,
Sure,
kids, and adults.
yeah.
Yeah. Now I would do CPR like for 1 to 8. They say you can use, one hand. But if you'll call 911, they can tell you exactly how to do it because you still breathe with kids, not with adults.
Yeah.
Other questions?
Is there the steps that you need to do
No, not, do you mean for adults? Yeah, we don't breathe on them anymore. When advanced rescue gets there, then they can take over because they have oxygen that's 100% oxygen, where what we get out of the atmosphere is, I think it's 18% oxygen. Somebody might have to check that. But adults have oxygen in their blood. So if we can do good compressions and circulate it, then that's better than trying to breathe.
Or years ago when I had a similar training, there's a session saying you need to do. So now that won't happen.
No, we don't check a pulse anymore either because what was happening was when people were checking pulses, they were so nervous, they were feeling their own pulse and they weren't starting CPR. So it was a nightmare. And the other thing is people don't want to breathe on people, right? So if we can at least get you to do compression, something is better than nothing. Yeah.
And if they don't need CPR, they'll let you know.
Yeah, they'll tackle. Stop. Yes.
So, again, old school CPR, but, so you were just gonna continue compressions nonstop, is that it? So you do need somebody there to.
Yeah, there's somebody to help you.
Yeah.
Yeah.
Get help 5 minutes.
Yeah, and this does come back on in 2 minutes and it will say, stop touching the patient and it will reevaluate the heart rhythm and then either recommend a shock or not recommend a shock. See, all the AEDs look different. That is my newer trainer AED over there, but they're all have the same simple steps. It's 1, 2, 3. So once you open it up, you turn it on and then it's going to go through a self-check to make sure the batteries and everything are good. And then it's going to tell you to attach the pads. Now, the newer AEDs already have this attached in like this. This is just a second step, but then it will have you attach the pads. And the pads all do have some visual to tell you where they go. And then it immediately goes into the analyze mode where it's looking to see if the heart rhythm is shockable or not. What I didn't tell you is when you have a cardiac arrest, your heart beats normally like this, right? That's its job. It circulates blood and oxygen. In cardiac arrest, one of two things happens. The heart either stops altogether, not beating. The other thing it can do is quiver. Now that quivering is the one that can be shocked by this back into a normal rhythm. And what we think is that CPR will keep you in that shockable rhythm. It buys us time until somebody gets an AED there. But the kind of the normal progression of the heart is quivering and then stop. But there are some people with medical conditions that they're just sick and already have a sick heart, like heart failure, for example, might be somebody. But they could have quivering too. Yes. No, you need most incidences where you have a kid that's in trouble, it's respiratory related. I don't know if it's because choking is probably one of the bigger causes, whether it's kids get respiratory illnesses and they just can't handle it, like an adult, immature lungs, autoimmune issues, those sorts of things. But they found when they looked at the causes for arrests in kids, it was usually respiratory.
Also, is it true that opioid related cardiac arrest is also respiratory in nature too?
Yeah, so great question. So, and it's unfortunate that we're starting to see a rise of this, but if there is an opioid overdose and you catch them soon enough, it might just be that they're not breathing. But so the telecommunicator, if there is information that's an overdose, they may add breathing to it. You're still not wrong to go ahead and start compressions. Because the other thing is, again, with the whole situation of an opioid overdose, would you want to breathe it? And so at least starting compressions will get some. Other questions? So y'all, let's try. If you'll stand up, there should be a mannequin that you all can get to. And then we have AEDs around that we can try. So whoever is standing by the mannequin, I just want you to take the heel of your hand and place it in the center of the chest. And try to get your shoulder squared over it. Yep. Good job. Okay, and stack the other hand on top. There you go.
Main part of the chest, not
Yep.
below the sternum.
Not below, in the middle.
Get the Heimlich. Heimlich is down here, right?
Actually, if they're standing, you can do the Heimlich from here. But if they go unconscious, you do it where you do chest compressions. Yeah, so there you go.
From
And
the
you
side.
can clicking. That means you're one. Yeah, not all of them click. Okay, that's good. Now just faster. 1, 2, 3, 1, 2, 3, 4, 5, 6, 8, 9, 10. You better stay in line. Yeah, good. And that makes it, you keep that. So faster. 1, 2, 3. Don't worry about it. Feel like
No.
That's perfect. Not easy though. Yep. I don't know. Where the movement line should be in the press line. Does anybody want to try? I keep you back. Keep doing okay. Good. Good. Slow you down a little bit.
kind of finding the rest of this.
Yeah. Yeah. Slow down. Three, four, perfect.
Further down.
Yeah, perfect.
So not like.
Push all the blood out of the heart, so when you go down, it needs time to empty, and then you need to fill back up, but now you're going too slow. If you're too fast, you don't give the heart time to fill back up. So it's kind of a six, whatever song you like, you can look at the AHA, they have a whole list of songs, and you can sing like row, row, row your boat, stay alive, but yeah, now go. Yeah, you know. Perfect. Anybody else? What might be-
I've already demonstrated.
But you can see how hard it is. It's tight. It's very tight. Yeah, chair, it's easier. Yeah, it's definitely easier on the ground to do that. Did you practice with your little?
No, but I was playing with it.
Okay, yeah. Okay, let's see. It's funny that the old ones aren't already attached, the peaks already are, which I like. So all that you do is turn it on and then follow the steps. And this actually has the pictures of what to do. It has audio and visual prompts. Actually tells you turn it on. 2 wants you to open it. 3 tells you how to undo the pads, and then it tells you where to stick.
Okay.
And so we place them as they tell us here and here. And then it's gonna start talking to you. The first thing it's gonna look for is the rhythm. It'll say, don't touch the patient, because you don't wanna be, it won't analyze it. The patient. So it'll tell you, stop touching the patient, and it's analyzing the heart rhythm. So if it sees a heart rhythm that needs to be shocked, which is that quivering one, it'll say, heart. And then when it's ready, it wants you to push the button and shock. It'll say shock advised. And then immediately go back to CPR. If it says no shock advised, then you run immediately back to CPR. And then it's gonna be quiet for 2 minutes, although I think this new one actually gives you the beat. I heard it had whatever sound it was, so that you could follow along with it. And then in 2 minutes, it's gonna say, stop touching the patient, and it'll reanalyze again. And you cannot hurt yourself with the AED unless you like attach the pads to yourself. But it's meant to be simple. You're not supposed to have been trained to use the AED. The whole point is it's automated. It'll tell you exactly what you need to do.
Just like cord is longer, right? So like this can fit off the side of the patient.
Yeah, they try to place it theoretically at the left side of the patient so that it is closer. And I'm assuming that the one pad probably has a longer cord, which is another way to tell where the pads actually go. I haven't opened this pad back yet, and I'm not gonna stick them on because they ruin my training. So there's more. Yeah, and then it should have pictures here of where it wants you to place them. So that you pull them apart and then just attach them. And they're sticky. So if I can get them apart here.
Better, harder.
And that's what I said, you have to check the pads because the adhesive doesn't expire, they'll dry out, and they won't stick.
If they don't stick, then it's not going to deliver the shock.
And like dead center, top of the middle of the chest. I would
Will it
think
tell
like
you
more
that?
like.
And if it doesn't have a good connection,
Yeah.
that's like,
Oh, okay.
you know. It'll say something like check pad connection or something like that. So you should always check to make sure they're stuck well and that they're actually plugged in, because you wouldn't change this plug out on your next set of pads. And I was trying to pull this out, really, this is a brand new trainer. There it goes. So it's, it only goes in one way.
So what if you have a situation where you have like
Enough force because you far down.
like a little chest hair, you don't have a razor, you don't have that.
And try to get it stuck as best you can. Yeah. I would just, push down and just as best you can, try to rub it so that it sticks as best it can. And I definitely on a hairy person, you gotta try something.
And if you can't, it does just do CPR.
And then hopefully when the 911 fire gets there, EMS and somebody will have the razor. But yeah, it's a good point that we should check the DCRI to see if they have a small kit that has a towel, scissors, and the razor. So,
It's like if someone wearing an undershirt or a t-shirt and they're on their car, like, it might be really hard, you know?
Be confident.
I can't.
it's funny that women are less likely to get CPR because of breasts. So a lot of our community training and education, we now have mannequins that have breasts so that people can train with them. It's fascinating.
Yeah, because I mean.
Nipple like and Jerry, right? Yeah, so go for the center of the chest.
I was thinking, well, for
That's pretty accurate. I would rather opt high than low because you'll be on those little bony prominences and more likely to break ribs, but you really want to be up where the heart is sitting.
Yeah.
So that it pushes, against it.
Okay.
That'll stop blinking if I get it in.
Great questions.
So as that's going on, the other person in pursuit can continue doing that until it's.
That hands off.
Yeah, it was all for analyzing.
Probably they really discouraged.
So deliver shock now. Press the R shock
That's the
delivered.
kicker, is
Pause.
if you're doing compression,
Begin
you
CPR.
have to keep compression going while somebody's putting that on, right? Because otherwise you're losing the minute. Yeah.
All right, well,
That's the hard part because.
just having that like sense of doing that.
Bare chest. Analyzing heart rhythm.
Yeah.
Do not touch the patient.
So until that time, you're still.
Because it doesn't.
Shock is on. Charging. Stay clear of patient.
Most more than.
Deliver shock now. Shock delivered. Pause.
Right. Got on, got turned off. You could do that.
Okay, this one goes there and then put this in.
Hang in there, hang in there.
Bare chest.
Okay.
Listen to the instructions.
Plug in pads connector. Analyzing heart rhythm. Do not touch the patient.
I go from Sarah helps figure out because I
Shock is on. Charging.
this one has a
Stay clear of patient.
It's a difficult job to wrangle with messages.
We need to do that.
So are you guys
We think so on the project.
Yeah, or people said that they have positive, they have a study that can do advertising.
Companies now have them reported to the office of EMS. So we have already listed AEDs, but whether the county has them
Yeah.
and available in 911.
Yeah. Okay.
Another thing,
Just go
Yeah.
look and like, yeah, go on an 80, I search my neighborhood.
Walmart had a national effort where they place AEDs, so if you have a Walmart near you, be worth looking into.
Library nearby, or like, things like that might help.
Library might have that.
Yeah.
I know in Forsyth County, all of our libraries do.
Oh, that's a good point.
So you.
Library has one, I'll go check. Next time I'm at my library, yeah.
If you County. I'm happy to send you a list of who I had for Durham County.
Everyone, thank you for joining us remotely for Tuesdays Together. This recording will end up being on the DCRI Pulse near the end of today, so you are more than welcome to review it. Thank you for hanging in with us as we had a couple of technical difficulties, and have a great day. Take care.
Stop. Years